Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Hi, everyone, and welcome back to the show. Great to have you with me here today. I can't wait to get into today's topic. It is literally one of the biggest, if not the biggest thing that we see in our practice. So we have what we call a clinical practice. This means that we do lab work, that we see people from the real world. And yes, there are so many great studies out there. There's so much research out there. It's absolutely fantastic. But what I care about is what actually happens in the real world. So we know in research that this should happen. We know through our studies that this should happen through biological processes, pathophysiological processes, that certain things should happen within the body. We know that, but I also like to say, great, does that happen in real life to real people? And that's what I try to share in the Cabral concept. It's not just what should happen according to the research, but it's what does happen. And then also, what are the long-term effects well over that 6-month research study's over, right? Or that 1-year research study. What happens 5 years from then, 10 years from then? That's what I try to bring you on today's show. So this topic is going to be important for both men and women. There's no doubt about it. But I'll tell you right now that the number one thing that we see affecting women far more than all the digestive issues. Now, again, don't get me wrong. Many women and men come into our practice for digestive issues. Bloating, gas, constipation, loose stool, any number of issues going on with the gut and feeling kind of bloated or retaining water around the midsection. We hear that every single day. We understand that, we get it, and that is pretty straightforward. Meaning that we do an organic acids test, we'll run a stool test, we can run a food sensitivity test, and we're going to find out what's going on in the gut. We'll find the candida overgrowth, we'll find the bacterial overgrowth, we'll find the H. pylori, we might find parasites, we'll find something, and then we go about correcting that. So that's almost more straightforward. It really is. People that have been dealing with gut issues for years, I tell people it's straightforward. Like it's straightforward. We're going to find out what it is, and then march forward to remove it, and then rejuvenate that gut. Not just put in the good bacteria afterwards, but make sure that it's balanced between small intestinal bacteria and large intestinal bacteria. And then also, we want to make sure that we seal up the gut wall so that all the inflammation, everything that comes along with it, is healed as well. So that's truly important. There's no doubt about that. But what most women will never know is that they're walking around right now estrogen dominant. And I want to explain today what that means. Because from a clinical standpoint, if you are a functional medicine doctor or integrative health practitioner, and you know how to read the labs, you can see that almost every woman with a health imbalance, it also comes full circle around to estrogen dominance. And now I'm not saying every single woman has this. I'm not saying that at all. But even Harvard University and their research has shown by the time women get into their 20s and 30s, they're producing less progesterone. And we're going to get into that as to why. Okay. So what I want to share with you are some really common signs and symptoms. So most women would never correlate these signs and symptoms to what's called estrogen dominance because they've been to their doctor and their doctor ran their blood work and estrogen was within range, no problem, right? Progesterone was within range. What they're missing though is the ratio. And that's what I want to explain today. So women can have perfectly normal estrogen. And I'm not saying they don't, because on the labs that I run, which are the labs any doctor can run, on those labs, estrogen is normal. It is normal. It might be in the lower end of normal, but it's still normal. But what we have are drastically lower levels of progesterone. And again, they might not be out of range low, but that's why we have to use functional medicine. Functional medicine means, as we're looking at labs, we don't just say the person has a disease, okay? Because that's a totally different ball game, right? When you're just talking about disease. We're talking about, why does someone feel the way they do? Why do they have those symptoms? And when you go to a conventional medicine or a specialist, they'll say, well, it's not out of range. So does that mean you're perfectly healthy? Of course not. Had I had my labs read by a functional medicine doctor or integrative health practitioner, when I first got sick, they would have found out right away what was wrong with me. But I didn't have that. And it was even more rare 20 years ago. It's fairly rare today. More doctors are getting into it, but again, they're not reading it from an optimal perspective because there's a large range. And just because you're not out of range on your blood work or the saliva-based testing right at home, which I'm going to teach you about today, does not mean that you're healthy. And it does not mean then you'll be symptom-free. So if you're looking for answers and you've run blood work before, you're not going to find them. You're just not going to find them on a standard blood work test. You're not. Blood work is not the end-all be-all. When you want to find out about your hormones, you run a saliva-based test. And I'll tell you why in just a moment. Let's go over those symptoms right now of what it feels like to be estrogen dominant. This can go for both men and women. I'm going to give men symptoms in just a second. The majority of people that we see with this are women. Here's why. They come in and they say, now right away, they might not open up with this, but they're typically saying, I have lower mood, I am more apathetic, I just don't care about things the way that I used to. It's what I call a case of the whatever. It's just like, whatever. You don't care. You're apathetic because you're so overwhelmed. And so you have lower endurance, lower stamina, lower libido. You tend to gain weight easier. It's harder for you to lose it. You start to put weight around the hips. You start to retain water weight around the belly. You can start to get sometimes tenderness of the breasts, especially anywhere from a week to 10 days before you get your period. You can start to get more headaches. You can start to get more bloating the second half of your cycle as well. Start to have more brain fog, or what we hear a lot about in our practice is fuzzy thinking. A lot of women just say, my brain feels more fuzzy. It doesn't feel like I'm able to think as clearly. I can't recall as easily. I forget what I'm doing, right? Then they also have to deal with, sometimes they have to battle with sleep issues. And a lot of this is taking place the last 10 days or so of their cycle. Okay, what does the cycle mean? Well, essentially what we're looking at is day one of menstruation. The first day you get your period, you count that as day one, okay? That starts the cycle. Now, about 14 days or so later, we start to switch from the follicular phase of a female cycle to the luteal base phase. Once we get to around days 17 or so, we're really ramping up progesterone. We're peaking out somewhere around days 19 through 21, 22, right around there. And then progesterone starts to slowly decline. Estrogen is declining as well. Well, what happens if estrogen stays normal, but progesterone never rose in the same way? You start to get these same exact symptoms. You can also start to get more acne on the chin or the jawline and not know why, not really understand what is going on. You start to feel more moody towards the last 7 days or so, a lot of the PMS-based symptoms. Some women are even experiencing the next level, chronic-based estrogen dominance, which can lead to missing periods or irregular cycles. It can lead to PCOS. It can lead to more of a sluggish-based metabolism. It can lead to real low levels of mood and depression. It can also have an effect on cancer-based growth or breast cancer or cystic breasts as well. It can, I think I talked about this before, especially in terms of thyroid, but a lot of times women mistake low thyroid for estrogen dominance because the thinning of the hair loss, the foggy thinking, the poor metabolism or blood flow, circulation, cold hands, cold feet, could also be estrogen dominance-based signs. These are important things to look at because here's the deal, it doesn't go away on its own. You can't just say, oh, well, I'm going to start to eat healthier and it's going to go away. It's not. There's something else holding you back from getting your health back. It really is. That's why when I wrote the Rain Barrel Effect, I gave you everything I do in my practice. Everything is in there. And I use something called the de-stress protocol. And diet is the first one. There's no doubt about it. You have to have that. You can't be eating poorly, right? If you eat a lot of processed food, you eat a lot of sugar, it's going to spike up and down your blood sugar, and that's going to create even more estrogen dominance. There's no doubt about that. But there's 7 more parts. It's not just about the diet. So we really have to understand this because, again, it's not getting better on its own. It leads to a lot of women having fertility-based issues, amenorrhea, and really not understanding why they don't feel in control of their body. Super important to understand this. They're dealing with weight issues and they can't lose the weight and they don't know why. So they go on crazy low carb diet. Guess what a crazy low carb diet does in the long term? Not the short term, but guess what it does in the long term? Creates more estrogen dominance because you're putting the body in a greater fight or flight survival based state. What happens at that time? Progesterone levels start to fall very, very predictably. Cortisol will go up, progesterone will begin to fall. As that happens, estrogen dominance becomes even worse. Now, estrogen is not increasing. I'm not saying that. But when you look at the ratio from estrogen to progesterone, it gets lower. You have to keep in mind that progesterone is an antagonist to estrogen. If you don't have enough progesterone, you're going to get more of the symptoms of estrogen. It will be dominant in that way, which is why this is one of the most overlooked issues right now in female health. Extremely important. Well, what about for men? Well, for men, it can lead to infertility. That's one of the biggest overlooked things for men as well. It can also lead to hair loss. It can lead to gynecomastia, which is enlargement of the breast tissue in men. It can lead to erectile dysfunction. And again, we're always looking at, well, improve blood flow, go to the gym, work out. Okay, all of that helps. All of it helps. But what are the deeper things that are causing this estrogen dominance in the first place? So I want to give you all the tools today to be able to fix this. I went through the symptoms right now. Okay, I went through those symptoms. The main ones that we see in our practice is this: lowered mood, lower libido, weight gain, water retention, apathy, just don't care as much. You just don't have that ambition, don't have that drive. It's just trying to get through the day. You feel so overwhelmed. Went through the bloating, talked about sometimes acne around the chin or jawline, and some sleep issues, oftentimes dealing with anxiety. Okay, that's what we see in our practice. That is huge. A lot of women will come in for digestive issues, things like that, but we run that thyroid adrenal hormone test, or even just an adrenal hormone, and we'll see. There it is, right there, plain and simple, right on the lab. Easy saliva-based test. And we test for the main form of estrogen, which is estradiol. And that lab should show somewhere between 1.3 and maybe 2 up to 3.3 max during the luteal-based phase. Very simple. Again, if you don't have your cycle, you can take the lab anytime. If you're feeling symptoms, but you don't get your period regularly, you'll still take it during those times of high symptoms of estrogen dominance that I just named. And if you have your cycle, you'll take the lab during days 19 through 21, one of those days on a normal work day, a normal stress day. And you want that lab somewhere between the 1.3 and around 2.0 for estrogen. Now, here's the problem. And again, I want you to be able to read these on your own. I talk about them on the Friday reviews. I talk about how to read the labs. Take back control of your own health, right? Because your doctor's not going to most likely know this. So here's the thing. Progesterone should be between 100 and 200 typically. 100 and 200 picograms per milliliter. You don't even need to know what that means. Just 100 to 200. That's it. And that's during the luteal-based phase. It could be higher. During those days, 19, 20, 21, somewhere right around there. And it could be higher if you wanted to. And then you want your progesterone to estrogen ratio to be above a 100. And I can't tell you how many women we see struggling with issues around here, and they never knew. They never knew. No one ever told them that all these symptoms could be due. Yes, normal estrogen. Okay, maybe normal progesterone, but the ratio is off. Not enough progesterone is what the majority of women are struggling with. So now let's talk about why. Why might they have low progesterone? The biggest issue is chronic stress. There are others, and I'm going to go through them. But the biggest issue is chronic stress. Not a day of stress, not 2 days of stress, not a week of stress. Chronic stress. All right. Chronic stress breaks down the body. I talk about this in the rain barrel effect. I've spoken about this before. It's called neuroendoimmunology. The nervous system is basically the input into the body. So just think about that. Body feels stressed, it affects the nervous system. If the nervous system is affected, what does it then do from there? Well, what it does is it affects the endocrine system. What's the endocrine system? Your hormones. Your hormones. So stress affects your hormones. And then what happens with chronic-based stress, chronic-based hormonal dysregulation? It leads to a weakened immune system. It leads to things like Th1 dominance, Th2 dominance. Th1, think of a lot of the autoimmune-based issues. Th2, think of a lot of the allergies, asthma, chronic inflammation, yeast-based issues. All right? So remember, when I go back and I say there's always an answer why, there's always an answer why. There is always an answer to why you feel the way that you do. And I believe that the only reason why I'm able to talk on a lot of these things, and the reason I found out about these things is because I didn't find my answer for 10 years. So think about the research and the quest that I was on for a decade. Had I found my answer in 6 months, had I found a doctor that knew how to do this, I wouldn't have probably learned all of this. I might have gone in a different direction in my life because it was never my direction to get into natural medicine. It never was. But life forced me to move in that direction. Now, of course, I'm happy that it did. I mean, this is my life's work and it's very rewarding and I feel great about it. But, there was a lot of pain to go through of that cathartic based process, right? To work through it. It's like, all right, I'm getting better. Then I relapse and I feel terrible. I'm like, this doesn't work. Nothing works. I'm never going to find my answer. Then I start to do something and I start to get better. I start to feel better. I said, oh, I'm getting well. This is it. I'm better. And then I relapse again. And I fall back just as bad as I ever was, right? So what I was able to discover, though, is I started to look into every form of medicine. And I realized that when you really study and you go deep on every form of medicine, they are all telling you the same thing except for conventional medicine, which is not true medicine. It's not. It's pharmacology. And again, I don't mean that in a derogatory way. It's the best in the world at pharmacology, that's for sure. And if you need something that's life-saving, like let's say you're bleeding out or you are literally having a heart attack or you're 85 years old with bilateral pneumonia and you're drowning in fluid in your own lungs, trust me, you want the best of conventional medicine. But I can tell you for sure, it's surgery and it's pharmacology. And there's nothing wrong with that. But let's be honest for what it is. It's the best in the world at that. Can't take an MRI. You can't do that in natural-based medicine. You just don't do that. But you can in conventional-based medicine. So it's great for that. But what conventional medicine is not great for is health care. It's great for sick care, but not for health care. If you want to get healthy, you need to do the things that get you healthy. And every major form of medicine, except conventional medicine, says you need to go back and you need to figure out what the root cause is. The root cause is this. If you have literally an elephant in pain and it's, I don't know what an elephant does for noise, but let's say it's screaming. It's, at the top of his lungs and it's limping and it's kicking and all of these different things. You can try to put a bandage around its foot. You can try to massage it. You can, keep giving it tranquilizers. But really what you need to do is figure out what that root cause is and pull that branch or stick or thorn right out of its foot, right? And then allow it to heal. You need to find out what it is that's causing you the true root cause of your underlying imbalances. Because estrogen dominance, think about it, weight gain, okay? We've got bloating, we have water retention, we have low mood, we have depression, we have problem sleeping. Well, we can medicate all of those things. Problem sleeping, here's Ambien. You have weight gain, well, we're going to put you on some special diet. Not a health-based diet, but some special diet to really, that will only work in the short term. That's going to really do trouble to your body in the long term. You have depression. Well, then here's an antidepressant. You have bloating. Here's an antispasmodic. You have heartburn or acid reflux. Here's some Prilosec or an acid blocker. But what are causing those things? That's what we need to look at. So we have to figure out what the role is of chronic stress. Because chronic stress, as you increase stress production hormone, that's epinephrine, adrenaline, cortisol, aldosterone, all of those things. Well, that'll make you hold water. Aldosterone alone, no one talks about it. The body's signal to hold on to sodium, to hold on to salt. What happens when you eat a lot of salt? That's imbalanced. You retain water, right? You know that. Go out to a restaurant, super salty meal. The next day you wake up and you can't get your rings off, or your face is all puffy. Sodium retention, a lot of salt. Wasn't balanced with enough potassium. It was just cheap table salt at a restaurant. Well, think about this. Your body naturally, your kidneys will signal this to retain sodium under a lot of stress. So when you begin to realize that the body works perfectly, but it's responding to stress, what do you have to do? Well, you have to start to begin to decrease the stress. And for you, I can't tell you exactly how to do that. I can tell you diet, I can tell you exercise, I can tell you the right nutritional supplements like Adrenal Soothe and taking magnesium at night and a lot of these great things, right? Deep sleep protocol, all of them work. But take those while figuring out how to reframe stress or remove some of these stressors from your life. And if you can't remove the stressors right now, we have to reframe how we're looking at stress and do the other things to help balance that, right? Push back just as hard. We also have to, again, I touched it briefly, but we need to get enough sleep. If you're surviving with enough sleep right now, that's not leading you to thrive. We need to get that body to bed by 10 p.m. We need to wake up with the sun. We need to get that body mobilized for the day. Aim for 8 hours per night and make it restful. You don't want to be waking up throughout the night. You need to figure out what those sleep issues are. Do you have high cortisol at night? Do you have a lot of anxiety? What's going on to wake you up? Really important. A big one that, I'll tell you right now, is overlooked is liver-based congestion. Now, you would say liver-based congestion, well, what does that mean? Well, it means that your liver is literally bogged down on trying to process all of these chemicals that I'll get to in a moment that also increase endogenous production of estrogen. So your liver needs help. Yes, it's doing its job on a daily basis, hourly basis, second by second basis. It's doing it. But is it able to keep up to the same degree? No, and we know that. Why? Because you can run a simple urine test, a toxicity test that will show you the toxins in your body. And if your liver was doing a perfect job, well, all of that would always be eliminated all the time. But you could do it fast, and you can take the test, and you'll still see it. Your body's constantly dealing with outside toxins, and I'll talk about that in just a second. What would help with the liver? Well, certainly a functional medicine detox that ramps up phase 1 and phase 2 will help with liver detoxification. The other thing that helps tremendously as well is making sure that you are doing things on a daily basis to support your liver, that you're adding things like a little bit of parsley to your food, that you're eating cruciferous vegetables such as broccoli and cauliflower and Brussels sprouts. All of these things help. Absolutely, they help. Even things just as simple as some vitamin C or an activated B complex. All of these things help your liver out on a daily basis. Lots of water on a daily basis to keep flushing the blood. Water moves to the blood. Your blood is 90% water. Let it flush the kidneys. Let it flush the liver. That's what we want to do, right? A 12-hour overnight fast will help to let that liver take care of all the toxins and not have new food, new processes coming in. And just a couple more things as well, because I know people are worried about toxins, and they should be. Plastics that you use every day will increase your own, well, they're considered what are called xenobiotics, or they're considered xenoestrogens or xenoestrogens as well. And what these things do is they actually add more of a outside component to estrogen to the body. So they're outside factors that affect the inside of the body. So we have endogenous estrogen production, that's our own production, and then we have exogenous, okay? And all of that can produce more estrogen in the body as well. So sometimes estrogen does go high. We do see that. Anytime a woman during the luteal-based phase is above a 2, we say, well, that's a decent amount of estrogen. If that was during the first 14 days, okay, we get it, but not the last 14 days, and certainly not around days 19, 20, 21, for sure. Okay, so I'd like to go over right now one supplement that can help with women with dealing with estrogen balance right now too. So that is a product that many of you have heard about, and that's called diindolylmethane, DIM, D-I-M. So it's just diindolylmethane, and this is pretty potent. Take about 200 milligrams per day. Ideally, we like to do it with breakfast and dinner, and what it's going to do is allow you to better metabolize estrogen, to better remove it from the body, and not let it converge and actually become a more toxic estrogen ester form, which your body has a more difficult time getting rid of, and it becomes more inflammatory. Another thing that's very powerful and helps quite a bit is something called indole-3-carbinol, I3C. Now, both of these work to balance estrogen in the body, no doubt about it. They don't allow for excess estrogen production, and they allow for better removal of it. I just mentioned, to get a lot of these products naturally, you would get them from cruciferous-based vegetables. You can also do things such as, I talked about this in a previous podcast. Just go to stephencabral.com/podcast and type in seed cycling. Just even type in SEED. There's probably not too many podcasts with the word seed in it. And what you'll find is a very natural way to help to begin to rebalance the body in terms of estrogen, progesterone production. Pumpkin seeds, sunflower seeds, flax seeds, etc. Check that episode out. But remember, a lot of say, well, I'm doing seed cycling. Here's the thing. Seed cycling, yes, in addition to do everything. Fix the gut. Begin to remove the stress, right? Remove a lot of these toxins. Get rid of the heavy metals. That's one that I didn't even mention. But aluminum, mercury, get these things out of the body, anything that causes inflammation. A lot of cosmetics increase estrogen-based production, right? So non-natural cosmetics. We'll be talking more about that in the future. And then even tap water. Believe it or not, I don't know if you do believe it, but here's the deal. I wrote about it in the rain barrel effect. Tap water is, if it's city municipal tap water, is often contaminated with birth control, antidepressants, etc. There is great research on this. And when you drink tap water, you're oftentimes getting more of these xenobiotics into your body. Super important that we look at this. So here's the thing. Here's what I want. If you rebalance your estrogen levels, here's what you can do. You can begin to burn body fat for energy. You can begin to utilize your own natural antidepressants. You can begin to remove all of that toxic water weight. Your thyroid, your adrenals, everything begins to rebalance and function at a more normal level. That means your metabolism improves, your energy improves, your stamina improves, your outlook on life improves. You're not as overwhelmed. You're not as anxious. You end up sleeping better, right? You start to really like the person you are and who you feel like because you've gotten control of your hormones. Remember, a lot of times what we think, how we feel is dictated by our physiology. We forget, yes, our mind, very, very powerful. Our psychology absolutely affects our physiology. If we're having a bad day, we're stressed, we're down, it affects our body. There's no doubt about it. But at the same time, if our body is not balanced and we don't feel well, we're having bloating issues, we're having gut issues, it affects our brain, it affects our psychology. Our physiology affects our psychology. The body affects the mind affects the body. We need to begin to integrate those and understand we need to work on both at the same time. So yes, you can do your Tai Chi, you can do your Hatha Yoga, you can do your stretching, your meditation, your Epsom salt soaks, your sauna. That is going to be good for the mind and the body, but start to rebalance that body as well. And first, even recognize, is there an issue? Is this an issue for me? Because now you feel like, okay, I get it. I understand. I see what's wrong with me. I'm going to go about correcting the problem. Too many people don't even recognize that there is a problem in the first place. These are symptoms are not normal, and I don't want you to suffer from them. The very best thing you could do is run the adrenal hormone test, which will give you your estrogen, progesterone ratio, testosterone, DHEA, and your cortisol all 4 times of the day to see what your stress levels are like or your energy levels are like. If you wanted to do the thyroid adrenal hormone, it's all those same biomarkers, and then you add on your vitamin D. You get your free T4, free T3, you get your TSH for your thyroid, as well as antibodies to see if you're making an autoimmune-based issue within the body called Hashimoto's and sometimes Graves that causes issues with your metabolism as well. And the last part it gives you is your blood sugar, hemoglobin A1C, and insulin. And that can lead to PCOS as well and a host of issues, especially with women. So this is a very important topic. And the reason I dedicated its own show is I'll tell you right now, besides the digestive issues that we see in women, this is the number 2. This is it. Besides the bloating, the constipation, the gas, the water retention around the belly, all of that, that's probably number 1. But number 2 that we see is estrogen dominance. But this is the one that a lot of women can't put a finger on, that specialists can't, that a lot of the experts out there can't because they're not reading the labs. And that's the issue. You can't guess at this because if you guess at this, it's going to look like a weight issue or a mind and mood issue, but it's not. It's actually a chemical imbalance inside of the hormones. The body is all about achieving equilibrium. It's all about balance. It's about homeostasis. And when something's off, and it's been off for a while due to chronic-based stress, the stress might be from heavy metals and toxins. It might be from GI, digestive-based issues. It could be from viruses, but something's off and it's causing stress in the body. Now, maybe it's just mental, emotional stress. It could be that too. But what it leads to then is a disruption in our hormonal-based system. And I'll tell you right now, the lab tests will prove it to you. But if you didn't want to do that, you can just get back on a de-stress-based protocol, right? You can start to go back, listen to previous podcasts, eat better, move better, and begin to take back control of your mind and body. I will put in the Estrogen Balance nutritional supplement in there, the Adrenal Soothe, I'll put in the magnesium, I'll put in the deep sleep protocol, and I will put in the lab test for the adrenal hormone and the thyroid adrenal hormone today at episode 1187. So just head on over to stephencabral.com/1187. Remember, you never have to purchase anything. You never have to get anything. But what you can do is you can look at the labs. You can look at the nutritional supplements. You can say, okay, I'm going to work with my doctor locally and they're going to do this. That's totally fine with me. My job is to get you the information. It has to be. Somebody has to get you this information that is not out there currently right now. And if you'd like to work with myself, if you'd like to run a lab through Equilibrium Nutrition, I read your lab. You get on a phone call with one of my health coaches for any of the labs. We explain it to you. And we don't just say, oh, everything's within range. No, we explain every single marker. And then we say, here is the plan we've developed for you to begin to achieve equilibrium. That's really what it's all about. So hopefully this has been helpful. And as always, if it has been, please feel free to to pass this information along to anyone else you believe it could serve. Thank you so much. Before you go, I wanted to share a personal story with you. The real reason I began to get well finally is because I figured out what was wrong with me. And that might seem pretty obvious, but I went from doctor to doctor for over 2 years before discovering at-home functional medicine lab testing. These are the labs that enabled me to finally figure out what was wrong with my hormones, blood sugar, electrolytes, and gut health. And once I knew what was wrong, I could then follow a proven plan in order to rebalance my body from the inside out. This is why I believe so strongly in functional medicine lab testing and why I've made it my mission to share these labs with the world. Now at equa.life, you can order an at-home lab test or lab bundle for you and your family and be able to complete it within the week. Plus, the EquaLife difference is that you're not left to try to read and figure out these labs on your own. We explain what your lab numbers mean, what they mean in the much bigger picture, and then how to go about rebalancing your body in order to heal. To see our full selection of lab tests or to set up a free lab selection call to find out what labs may be best for you, simply head on over to equa.life/labs. And do remember, we ship these all over the world. To find out more and to set up your free lab selection call, simply head on over to equa.life/labs. That's EQUI.LIFE/labs.